More than 1,000 people are planning to flood a meeting tonight about medical marijuana right here in Colorado.
Opponents say that changing the rules would put their medical care in jeopardy and also strict regulations on marijuana providers. Fox 31's Greg Nieto is live at the Auraria Campus this morning where the hearing is set to start. So, Greg, what is each side of this medical debate? Because I know it's sure to get pretty heated.
Yeah, well, in essence, it could cut down on the number of places folks could actually go and get marijuana for medical purposes. One group by the name of Sensible Colorado estimates they will have more than 1,000 patients and supporters on hand here inside the Tivoli Student Union on the Auraria Campus for this very important hearing, which begins at 9 o'clock this morning. It is a hearing that ultimately could change some of the ways we deal with medical marijuana in the state of Colorado and could affect lives like a 29-year-old woman living with multiple sclerosis that Fox 31 talked to yesterday. She lives in Littleton. She says medical marijuana helps her and allows her to cut back on the other pain pills she takes every day. She worries what will happen to patients like her if the State Board of Health limits medical marijuana providers to 5 patients each. The health department argues there is nothing in Amendment 20 that allows for the creation of dispensaries and that caregivers must be people, not businesses, pointing out that home health nurses typically see no more than 5 patients per day. But you talk to one medical marijuana provider, co-owner, she says that she's actually setting a 5-patient limit, and if she were to do so, that would actually shut her down. She worries there wouldn't be enough providers to accommodate the estimated 9,000 registered medical marijuana patients whom she believes needs help. As for the hearing itself, again, it starts at 9 o'clock this morning, and at least according to one program note here, apparently there will be 1 hour for proponent testimony in regards to some of these changes to Amendment 20, and then get this, guys, actually a 6-hour window for opponent testimony. So you can imagine the State Board of Health expecting to hear from a lot of folks later on this morning.
Really, Greg? So it's fairly unbalanced in terms of who's going to get the most time to plead their case.
Yeah, at least in theory it says that. We're reading an hour for proponent testimony and again from 10 a.m. to 4 p.m. for opponent testimony, but you have to wonder if more folks show up than they anticipate to actually argue in favor of some of these proposed changes. They will allow as much time as possible.
Very interesting there. Okay, Greg Nieto, we'll be checking in with you again later on this morning. Thank you so much.